Hey, Brent, it is very good to see you. As you know, Medicare open enrollment is around the corner. We're talking about planning for healthcare in retirement. In retirement, your biggest expense is almost always healthcare, and open enrollment is coming. Everybody needs to mark it down on their calendars, October 15th through December 7th. So, Brent, do you have any guidance for someone who is 65 and now qualifies for Medicare?
Yeah, so essentially the open enrollment period is for anybody who has a Part C or a Medicare Advantage plan or a Part D, which is a prescription drug plan. That window allows you to shop to start a new plan the following year, 1/1/2023. And so if somebody doesn't like their plan, or maybe the carrier made some changes that you don't care for, you're now able to go out and shop and then take a look at the new plans for the new year.
Okay. Now, what if my spouse qualifies for Medicare, but I don't?
Yeah, good question. So once somebody becomes Medicare age eligible, that's age 65, they are now able to transition to Medicare. So if they're on an employer plan where the prices are very expensive, they may be able to save quite a bit of money when they transition to Medicare. So this is something we help clients with often, because the number one thing I recommend with Medicare is, with all the mail they receive, with all the advertisements out there, there's a lot of confusion. Work with an agent, work with somebody who's done this stuff before, and they can guide you through the process.
Yeah, you're right. That is very important. Something else you said that you are specifically helping clients with when, let's say that you're eligible for Medicare at 65, like you mentioned, but part of the great resignation, I want to retire now when I'm 60.
Right.
What do I do for those 5 gap years?
So it's actually a really exciting time for those gap years, as exciting as that can be. But essentially, it used to be that if you were going to retire early, you better factor in about $2,000 a month for a couple to pay those healthcare costs. So since the creation of the Affordable Care Act and these subsidies, where essentially the government will pay a piece of your premium, some or all of your premium, there's really some strategies you can take advantage of to retire early and then get the government to assist you with paying for that coverage.
All right. That's nice that you said you're actually able to help families save thousands of dollars by kind of
Absolutely.
working through what's best for them.
Correct. And get retired early, which people always love.
I do love that. It's awesome. And the last thing that I wanted to ask about HSAs, health savings accounts, because this is when people are picking their healthcare options generally, right? What is an HSA and do you recommend them?
Yes. So HSA is going to be separate from the Medicare story, because once you're on Medicare, you cannot contribute to an HSA, but you can use the dollars that you put in there prior to getting on Medicare. So an HSA is triple tax deferred, which means you put funds in pre-tax, the interest grows, and then when you pull funds out, you don't have to pay tax on the interest or the principal. So it is a very effective tool for saving for retirement. And like you said at the beginning, healthcare costs are astronomical. They're only going to go up. So to have a nice bucket of money to go into retirement in the form of an HSA is really going to benefit people.
And
So
triple
if you
tax
have it
advantage.
available, make sure to use it.
Yeah, that's awesome. Brent, this was helpful. And like you said, there's so many kind of flyers out there and it can be really overwhelming. If somebody would like to sort through this with you, and again, while that open enrollment is around the corner, what's the best way to reach you?
Yeah, you can go to our website, www.young-wm.com, or you can go to or give us a phone call at 614-430-8383, and we'll get you on the schedule.
All right, perfect. Brent, thank you very much.
Thank you.